Hi, my name's Gail Wickham. I'm a physiotherapist who works at the Australian Catholic University Health Clinic, and Terry kindly invited me to speak to the ataxia group a little bit about physiotherapy and the role that it might play in people who've got Friedreich's ataxia. So I'm going to start just by having a little bit of a look at the evidence for physiotherapy, I guess, with other neurological conditions. So we know that there are significant benefits in having physiotherapy post-stroke. We've got the National Stroke Foundation guidelines that are best practice guidelines, really, that have given us a guideline that we should be encouraging people to walk as much as they can, to do as much practice as they can, particularly in the first 6 months or so post-stroke. There's also strong evidence for what we call functional task training, so things like if you have difficulty with sit to stand, practicing sit to stand. The other evidence that there's quite an amount growing for is Parkinson's disease, which is another common neurological condition. And so we have quite strong evidence now for cueing of cadence, which means getting people to try and take longer steps, and that might be through an auditory cue, such as clapping, or it might be through some visual cues, such as some strips on the floor. And the other thing that there's evidence for is fitness training and cardiovascular respiratory training, getting patients with neurological diseases fitter. I guess the difficulty with Friedreich's ataxia is that we're dealing with a disease where there's a lot fewer people affected by it. And what that means is it's very difficult to do randomised control trials. We don't have large study numbers where we've been able to give one group a particular intervention and then give another group a specific physiotherapy intervention. So a lot of the evidence for Friedreich's ataxia is lower level evidence, so it's not as strong as we have for our other more frequent neurological conditions. Just going to touch a little bit about neuroplasticity, because there's certainly heaps of research growing in this area. So when we talk about the importance of the brain changing and the brain changing with practice, there's a few points that I want to raise about the type of practice that's been found to be important. So one of the first things that's important is the intensity of the practice, so how often people do the practice. And there's certainly a figure that gets bandied about of around 2,000 repetitions. And if we think about that number, that often coincides to the amount of practice that you would get if you did an intervention for, say, 3 times a week for a 6 to 8 week block. And that's a common period of intervention for physiotherapy research studies in the area of neurological physiotherapy. So we know that the practice needs to be intense. The other thing about the practice, in order to drive change in the brain, is that we know that it needs to be high in those repetitions. So the practice needs to be at a high functional level, and it needs to be repeated frequently in order to change the brain. The practice has also got to be complex. So the practice, certainly to improve that higher skill level, needs to be quite novel, quite targeted to the specific component of the movement or the task that the person has difficulty doing. So, for example, practicing walking just in a corridor might not specifically improve someone's ability to walk on uneven ground, for example. So there's evidence that the practice that we do needs to be very targeted towards what we want to achieve, and it needs to have complexity around it. The last couple that I've got written down in the slides are relevance, and I think relevance is can't be underestimated. The thing that the person's practicing has to be important to them. And I have a lovely recent example of that, where we had a lady come for some intensive physiotherapy with her arm, and this was post-stroke. And she set herself some functional goals, and she came back after a period of intense training to be reviewed. And the things that were most relevant to her were the things that she'd been able to continue doing. In this case, that was eating with a knife and fork, and it was blow-drying her hair, two-handed. But the things that were kind of a bit, I wouldn't mind being able to do that, and that was playing tennis, and I wouldn't mind getting back to the piano, hadn't been maintained because they hadn't been practiced regularly. And when we got down to the importance of the goals, they weren't as important in everyday life as blow-drying the hair and using a knife and fork. So we've got to choose things that are to practice that are meaningful to the person. And that's partly because if it's not meaningful, they're not going to practice it enough. and it's partly because it's the meaningful practice that drives the reorganisation of the brain.